In that magazine, which is Winter 2011 edition, they said, if you are sick and tired of feeling sick and tired, why not try an alternative therapy? Okay, it's the important thing to understand what they're saying. Why not try an alternative therapy? You do not need to be unwell to benefit from naturopathy. That's the best marketing speech. Unders anyway. Naturopathic treatments boost the body's natural healing potential, restoring harmony and preventing disease. Reflexology, reflex points, blah, blah, blah. And these points respond to pressure, stimulating the body's own natural healing processes. The body starts progressively clearing blockages and re-establishing and balancing energy flows, resulting in better health. Among the painful, congested, sluggish or overactive states within the body that reflexology can balance and normalise are constipation, asthma and stroke. This is in that brochure which came from the Teachers Health Fund. Right? This is teachers, right, who have been pushed for this stuff. So we wrote off to the Teachers Health Fund and said, give us a break. You know, are you really serious about this? You know, and lo and behold, they didn't respond. A number of other people, though, did, and various skeptics, one in South Australia, one elsewhere, etc., wrote to them, and they did get a response. So basically, it was saying, long-winded, but saying bugger off. We know what we're doing. This is ours, and they do it because there's money. They do it because of market demand. Our members want this stuff, so we do it. So we'd say, if your members wanted to whirl a cat round their head 3 times, would you cover that? No. Crystal therapy? No, we didn't cover that, I presume. Anyway, so we wrote off to the Private Health Industry Ombudsman, the umbrella organisation. And, like the Universities Australia, and like the TGA, if you deal with the Therapeutic Goods Administration, they say it's not our area. It's not our problem. We have to regulate the health funds if they break the law. The one thing they did say in the response that one of our skeptics got was this. It is not the role of a private health insurer, the insurer, right, to commence or dissuade a member regarding treatment they use. See, you are not designed to persuade them to use a particular treatment. If you're feeling sick and tired of being sick and tired, why not try an alternative therapy, right? That's contravention specifically of what the Ombudsman has said they can't do. Now the thing is that a lot of these healthcare, these health insurance things in these areas are always tend to be part of the extras package. Not part of your main health package, part of extras. And therefore they're lumped in with things like dental, braces, crutches, all sorts of things like that. So bunch of, if you want to say, I don't want my healthcare that I'm paying, for which my rates have doubled in the last 10 years, etc., right? I don't want to pay for those things because I don't use them, I don't believe them, I think they're silly. They say, fine, we'll take them off, you now have to pay more. Now, I've heard from a representative of the NBF, no, not an ex-person, used to work for the NBF, the Medical Benefits Fund, which is now Bupa, that the alternative health things are in the extras because they subsidise the other stuff. So in other words, they make a lot of money out of the alternative healthcare component of that extras coverage. So if you don't want that, you're at greater risk to the health fund. So it's purely making money. That's what it's all about, right? Not about ethics. We asked them, how do you justify putting this stuff, health funds, how do you justify putting this stuff in your, how do you rationalise if these things don't work? And we asked all these 35 different health funds, and we got one response.
What was it?
Medibank Private. Very bold enough to say, and they came out very thankfully, and they made sort of things like saying, we do it because the members want it. The decision to cover natural therapies is driven by recognition of members' health choices and demand. We understand the clinical benefits are contested. However, as stated above, if the clinical team produce evidence that the therapy in question is unsafe, then this will not be supported. In other words, they won't support it if it's unsafe. They will support it if it doesn't work. In this chart of health funds and what they do cover, most recent issue, subscribe now, you get it. There is one health fund with a white line against the whole lot. They don't cover any of these things. And that health fund is the doctor's health fund.